Hi, my name is Yusuf Khalil, and today I will be talking about the evolution of combat medicine and field care from the Civil War to modern day. I plan on doing this by comparing and contrasting the equipment and skill available today to the ones available during the American Civil War. Now, there are many ways to treat combat inflicted wounds that happen on the battlefield. All soldiers will be accompanied by a medic in their active squad to attend to any wounds or complications a soldier may encounter in battle. Modern-day field medics have been trained to at least an EMT level, which is a 16-week class in the U.S. Army. These courses provide information on first aid and frontline trauma care on the battlefield. Future medics taking this class will also be taught how to provide medical attention for longer periods of time in case a physician is not available. So either way, an injured soldier today will be in the presence of a trained professional more times than not. Modern-day medics carry a first aid kit on them at all times and are protected under medical neutrality. Medical neutrality is a principle of non-interference with medical services in times of armed conflict. This principle dates back to 1988. This allows medics to care for injured soldiers in the field of battle without having to worry about getting shot or attacked. These medics are identified by an insignia located on their uniforms, although some enemies may not respect the laws of war and still target them. Modern first aid kits contain a long list of assorted equipment, ranging from fluid resuscitation, hemorrhage control, airway management, and battlefield medicines. This list includes IV fluids and tubing, trauma bandages, assorted gauze, different size catheters, and surgical kits. The medicines carried consist of morphine, antibiotics, Narcan, Phenergan, EpiPens for allergic reactions, acetaminophen, ibuprofen, Benadryl, and even things like Pepto-Bismol for diarrhea and upset stomachs. As you can see, the modern-day medic carries almost everything needed and training to care for an injured soldier until they can be sent to a hospital for further care. This is very different from the way things were during the bloody Civil War. During the war, medical practitioners were unaware of germ theory and antiseptic technique. So right from the get-go, soldiers fighting in the Civil War were at much higher risk of infection and disease. It is said that 2/3 of the Civil War soldiers died of disease and not battle wounds. If you were a soldier that got injured during the Civil War, you would end up getting rushed down railroad lines to nearby towns with makeshift hospitals where maybe one of 20 medics are actually qualified to treat you and practice medicine. The rest were men and women with different professions carrying out amputations and bandaging up soldiers any way they knew how. The hospitals were messy and hygiene was terrible, which promoted infections and disease furthermore. An American poet and Civil War nurse, Walt Whitman, wrote about his many visits to different hospitals during the war. He speaks of seeing heaps of amputated feet, legs, arms, and hands so big they could fill up a one-horse cart. He also speaks of some hospitals being merely tents, and the injured were lucky if they had a blanket or pile of leaves to sprawl out on. He states that these hospitals were overcrowded and had no system of organization, so sometimes the injured would be left unattended and die before getting the attention needed. Medics during the Civil War did not carry very much on them, even the equipment in hospitals were very minimal and scarce. These medics carried an amputation kit with various saws, clippers, and cloths. They also carried a field medicine case and bleeding or blistering cups for drawing blood. Although morphine was around at the time, the supply was lacking, so soldiers who got treated with the medicine were very fortunate. Others would have to settle with shots of whiskey and a piece of cloth to bite on. Luckily for amputees, anesthesia was available for soldiers if taken to a hospital. Others were amputated with no anesthetics, going through 5 to 10 minutes of straight saw-to-bone action. Anesthesia was available in forms of ether and chloroform. Ether was unpopular because its flammable properties made it unsafe to use in their available workspace. Even though anesthesia may have helped some soldiers get through their amputations, that was only half the battle. Due to the absence of antibiotics, a large majority of soldiers that received amputations died shortly after to infection and disease. Getting shot during the Civil War almost certainly meant death, and if the bullet hit the torso, death was a certainty. Although these times were plagued with death and disease, the Civil War helped revolutionize medicine and advance the practice in many ways, one of which is the accumulation of records and detailed reports. This gave physicians a complete military medical history, that led to the publication of many books and studies that helped grow our knowledge. Another way the Civil War helped revolutionize medicine drastically was through the development of a system to manage mass casualties. This was one of the biggest problems in field hospitals and was talked about by Walt Whitman as mentioned earlier in this video. These mass casualties helped shape the way for organization, wound, and time management for World War I, World War II, and the Korean War. In addition to new management systems in hospitals, the importance of sanitation and hygiene in preventing infection and disease was finally recognized. This may be one of the most important advancements made in medicine during the Civil War and changed the way medicine was practiced forever.